Good afternoon, everybody, and welcome to our Monday edition of On the Town. We are featuring today your local hospital, and then my guest is Dr. Jason Wallace. Jason, welcome.
Thank you. It's good to be here.
Yes.
Good to be here. And I've been in Grass Valley and Nevada City from kindergarten up through high school, graduated from Nevada Union. Getting through undergrad, I took kind of a winding road. I went to Rexburg, Idaho, where I spent a year there. Back then that was called Ricks College. Now it's BYU, Idaho. And then I went on a mission for my church, the Church of Jesus Christ of Latter-day Saints, for 2 years.
To Philadelphia.
To Philadelphia, of all places.
What was that like?
It was quite an experience coming from this small town. It was a blast of culture. I learned how to speak Spanish, so I spent a lot of time in North Philadelphia. But I really grew to love those people, and it was a wonderful experience. I think it was an experience that kind of set the tone for my life, serving other people, learning how to interact with other people. It was just a wonderful experience all around. To become a doctor, you need usually 4 years of an undergraduate degree. Mine was in biology from BYU. And then I went to Western University of Health Sciences, which is down in Southern California, in Pomona, California. And that's where I did 4 years of medical school training. My program was specifically Doctor of Osteopathic Medicine, and that differs a little bit different than MDs. What I tell people, it's very similar. I received similar training in pathophysiology, pharmacology, so, what a disease is, how to treat the disease, what medications to use, what studies, tests to order, things of that sort. A DO does get a little bit of extra training in hands-on manipulation is what I used to call it, or therapy. So I deal with a lot of people who have chronic illnesses, work with a lot of people that have diabetes and heart disease, heart failure, things of that sort. I definitely think it's important to practice preventative medicine. We're in a day and age where we have a lot of things where, we can do our best to prevent disease before it occurs, and we have the ability to, through routine and regular screenings, hopefully catch any diseases before they get too bad. One thing that we all realize is the difficulty with cost of medicine. That's something that people think that I'm a doctor and I'm immune to that. I'm not. I know how much it costs to provide or to receive good medical care. With the things that I deal with more routinely are certainly medications for diabetes, and then medications, inhalers, things for emphysema, COPD, things of that sort. But it is difficult. There's great options for treatment, but sometimes getting those good medications to the patient is a struggle. My wife and I, we would always come. We're fortunate to come here every other summer to visit family, and it's a great place. I mean, you can't beat Nevada City and Grass Valley. It's just a wonderful place to visit. What really was the main reason for us moving was my father passed away at the end of June. He died in a motorcycle accident, so it was very sudden. And after my wife and I came out here for the funeral, we sat down and talked, and we felt like it was a time to be close to family and to help them during this difficult time as we kind of find a new normal, what life would be like without my father. We are taking new patients. We're open for business. Feel free to call and make an appointment. My office is located at 280 Sierra College Drive, Suite 120.
Well, Dr. Jason Wallace, thank you so much for taking the time. Wish you a lot of luck.
Thank you so much. I appreciate it.
You're a great young man. Thank you so much.
Thank you.